I would first introduce myself and say my name and explain Mohs surgery to them, including the process. I will look at her biopsy and familiarize myself with it so I can answer any questions she may have about her cancer, and then I will allow them to talk about their worries and concerns for the surgery and allow them to ask me any questions. I'll make sure the patient has nothing to worry about and I'll inform them about the different types of cancer. Most surgeries used to treat skin cancer, and this surgery removes the skin that contains the cancer, and the ultimate goal of the surgery is to only have cancer free tissues remaining. Basal cell carcinoma is the most frequently occurring form of skin cancer. The basal cell carcinoma rarely ever spreads from the origin and is not life threatening. The carcinoma is in the epidermis of the skin. Even though the carcinoma is not life threatening, it should be removed because it can be permanent. The characters the characteristics associated with basal cell carcinoma are open sores, red patches, pink growths, and shiny bumps. The dermatologist will perform the surgery, and I will assure her that she is in safe hands. Dermatologists are doctors who specialize in skin related conditions. Depending on how big the tumor is, the time of the surgery can range from 1 hour to 3 hours, and she will be under local anesthesia, which means she will be awake for the surgery. After the first layer of tissue is removed with a scalpel or a curette, which are the surgical instruments, a lab physician will look at the tissue under a microscope, which is mapping the tumor. During this time, she'll wait in the waiting room depending on whether the cancer is completely removed or not, if it isn't, she will go back into the surgery room and she'll get the rest. Doctor will go into the second layer of skin and check if that has cancer also. And depending on how long that takes, it could range from 1 to 3 hours. And this process goes on until her skin is 100% cancer free. The wound site will has to be kept covered so it's not open to infections, and I will tell her to make sure the spot of the incision remains dry for at least 1 day so it is not prone to infections. I will tell her scarring will occur and it could possibly be permanent, which is a risk of the surgery, but I will assure her that most patients who go through this don't typically have scarring for the rest of their lives and usually goes away like a month later. And I will tell her to come back in a week in order to remove her stitches.